Okay, so the video cut off before I could finish. We just have this last slide, so I'm just going to finish it in less than 5 minutes. All right, so I mentioned that Medicaid managed care plans don't just have the problem of providers receiving lower reimbursements, but also there's fewer benefits that are attached to it. And if you guys would remember, Medicaid is paid for by states. So, and different states have different benefits that they provide on the Medicaid. So, with states that have less benefits that the states have provided, Medicaid enrollees tend to have fewer, get fewer things out of it. And what states, particularly for states that have expanded Medicaid, there's usually more finances that have been put in it and more benefits that have been put in it. So they tend to have better services under their Medicaid managed care plans. So for the states, particularly for states that have not expanded Medicaid, the enrollees in those states tend to have fewer benefits and also fewer restrictions in terms of providers that agree to be in network, and a lot of this having to do with funding limitations. Then patients with diabetes and heart conditions, usually patients with chronic conditions, tend to face medications that are high cost because a lot of their medications are still very much within patent, so there are not a lot of generic products available for it, but also there's a lot of advancement that goes into pharmaceutical with chronic conditions. You would notice that a lot of pharmaceutical companies put in a lot of money, a lot of research into chronic conditions. And so some of the best medications, you would find them to be brand names rather than generic. So for people who have chronic conditions, it can be quite limiting for them because these medications generally have higher out-of-pocket payments, so they're still having to struggle with that. And some of the administrative challenges that come with managed care, cost containment, is also leading some of the complications to it. Firstly, many managed care organizations have different ways that they do things. They is their own system. So you have, let's use for example, you have three different managed care organizations. They are not going to operate in exactly the same way, but some of the times they may be dealing with the same providers, which can cause a bit of challenges and redundancy in an inefficiency for the providers who are probably having to deal with several insurance companies for their various patients, and so that can be quite a challenge for them. And also the plan systems are very complex, and it's very, very difficult for most patients to fully understand what is covered and what isn't covered, and also difficult for patients to also understand what one insurer requires versus what another insurer requires. So I'm sure if this is you guys' first time learning about managed care, a lot of things may be sounding very new and very complicated for you. Now, imagine you are a patient who is in let's use for example, a diabetes disease management program. How much more confused you would be in so many of the things that is happening, even if you have a great case manager. So it's very complicated. It was meant to be, bring some kind of efficiency, but the complexity of it has, you know, hasn't done such a great job in achieving that. So this is where we end for this module. I have really tried to cover as much ground for this because managed care is such a big part of the US healthcare system, and it's very, very complex. So I tried as much as possible to cover as many grounds as possible, so that you kind of get a good sense of what this is and how it operates. So I hope this was meaningful for you. If you have any question, please use the Q&A board to ask, and I will be very happy to answer your question. Do have a lovely day. Bye.